You're watching CTOM TV. Knowledge is power.
So Sonia has sent us a question as well, Alex. It's about her daughter. My daughter has AML. Her doctor said it was caused by her growing too fast, and that my other children are not at risk as they are not twins. He also said there is no need to do genetic testing as AML is not a genetic disease. Are my other children truly not at risk?
Yeah. Okay, I have heard similar stories to that with other types of childhood cancers. Childhood cancers are inherited, all of them. You don't get cancer at that age without a substantial reason. There's always a genetic factor. You just have to look for it.
Okay.
And that is true with AML too. So
now she didn't say her, just to be clear, she didn't say her daughter was it's her child, but she didn't say how old she was.
Right.
So
right, that is true.
I'm just clarifying.
Yeah, that's not a child.
By
that's
all
true.
means. Well, it could be, but it's not
true.
clear.
That is true. Yes, that is a very good point. I assumed it was childhood.
But go ahead, answer it for the childhood part.
For the childhood and the
yes,
adult part?
please,
Okay.
thank you, because we want to cover all the bases.
Let's call it somebody under 50.
Okay, someone under 50.
Someone under 50 with
Okay.
AML. So basically having a person with AML in your family, any sort of relative, increases your risk of getting the disease.
You mean it means it's more likely that you have an inherited mutation? It's
exactly,
not like
that you may have too.
Right, okay.
Yeah, so you have a higher risk of getting that same disease.
Okay.
Identical twins for sure, especially if they're if one of the twins gets cancer at a very young age, then there's an incredibly high chance, because identical twins typically come from the same egg. So that should be proof right there that it's an inherited based disease, because if it wasn't, then identical twins would not have such a high risk of both getting it. So that tells you right there, it's something that's going on in that egg that they shared.
Okay. So how could it be growing too fast, for starters? Like, that just kind of makes me concerned right there.
Yeah, that's just kind of...
Is there any evidence to suggest that somebody got cancer from growing too fast?
There are some metabolic diseases. It could have just been, maybe Sonia didn't quite understand what the doctor was saying. I'm not sure.
Okay.
But there's another issue that is quite significant too. There's a lot of inherited genetic mutations. In fact, I was reading recently about a study where scientists sequenced 80 genes involved with AML, and they sequenced these genes from donors who were donating their stem cells for a stem cell transplant to these people. They wanted to make sure that these people with AML were getting good, solid, wholesome stem cells. So they sequenced the donors' stem cells, and they found that almost 44% of those donors had a inherited mutation in the donor cells that were involved with AML, almost 44%.
Wow.
And then on top of that, out of that 44%, 84% were known to be pathogenic and causative.
Oh, wow.
And then what they did was they followed these mutations and they tracked them in the patients. And they tested the patients a few years later, and they found that later on in the patients, 100% of those patients actually had those mutations that were found in the donors.
Well, that's a little scary.
It is, yes. I thought that was very, very interesting study. Yeah.
Okay, so the fundamental question she's asking is, are my other children at risk?
I think yes. And I think what you need to do is get genetic testing. You need tumor DNA testing for your daughter, and you need genetic testing to see if there is any type of inherited mutation, even, a BRCA1 or a BRCA2.
Then you can breathe a sigh of relief potentially for your other kids, and have all the options on the table for your daughter.
Thank you for watching CTOM TV. Subscribe below and stay informed.